Eyesight is something we often take for granted until it is gone completely. Did you know that for millions of people in India, preventable blindness steals their independence and opportunity to live their lives with dignity? But there are a few extraordinary leaders who have dedicated their lives to restoring sight, hope, and dignity among them. Hi everyone, I am Shweta, and in this episode of Leadership Lounge with the CEO magazine, we have with us Dr. Purendra Bhasin, a pioneer in ophthalmology and the driving force behind Ratan Jyoti Netralaya, a super specialty institute known for advanced ophthalmology in Gwalior. Let's welcome Dr. Purendra Bhasin. Dr. Bhasin, thank you for joining us, and it's a pleasure to have you here. How have you been, sir?
Fine, thank you. It's pleasure for me to be on this interview for with you and with the
Thank,
CEO magazine.
thank you so much, sir. So, let's start from the very beginning. Could you please tell us what brought you to medicine, and even within medicine, what made you choose ophthalmology in particular?
That is very interesting question, and I've been taken to my initial years when I started, when there was a chance for me to select and opt for the medical field. So the thing is, why I entered into medicine, because way back in school days, my inclination was for towards the biology, and these subjects related to biology and human anatomy, physiology, though that used to lure me, and that made me develop my interest into medicine and medical field. And the other reason, what I was not good in mathematics, and that's the other reason which propelled me, which convinced me to enter into biology
Okay.
this way. So, other fields like engineering, like accountancy, they all require a lot of mathematics. So it was very heavy for me when I was a student. So I was good in, and I used to score good marks in biology subjects. That was the reason.
Okay, but why ophthalmology? Why not some other specialization?
Okay. So 1983, I entered into medical stream. So
Okay.
that was MBBS undergraduates. So
Hmm.
undergraduation went smoothly. So everything went phase wise, and I learned everything. And things were very cordial for me, very positive for me throughout. And
Okay.
then after doing my internship and completing it, and when the time came to select, because during those days this kind of neat PG was not there, only PMT was there
Hmm.
for the medical, and for post graduation it was not there. So it was on the basis of merits. So with the merits, I could get many other branches also, but ophthalmology is something which attracted me, because this is a branch which involves both surgical field as well as medical field.
Right.
So like you have to do the for the allergies also, like eye drops also, spectacle dispensing, and many other things. And at the same time you are getting the feel of and intricacies of surgery. So this was best of the both worlds, and that attracted me. Another reason, which was from my family side or from my inner heart.
Hmm.
Actually, during my MBBS days, my father had a lot of issues in his eyes,
Okay.
and for which he had to stay for long, and he was not getting recovered, and he had a lot of issues for long, for I think 5 7 years, and his vision came down drastically. So
Okay.
that also gave me that I should do something in this field, so that this field, which is not very much developed in our country at that
Yeah.
time, and more so in this region. So why not to do something for in this field only? So when I went out on that very day, I still remember. So my father just told me, if you feel like, you can join ophthalmology, eyes specialty. And it so happened that when I went inside during this thing, when the meeting was going on, so there were so many things in my mind. My friends told me something, others told me something, but I spoke out like, I want to go enter into ophthalmology. It happened so. So it was like this. So there were two reasons for entering into ophthalmology, and everything has changed after the time, because during those days the this branch was very nascent. Like
Yeah.
other branches, not very much developed in, like oncology, radiology, general surgery. During those days, open surgeries were there, gynecology, medical branches, medicine branches. So all these branches, orthopedics, so they all were developing. And new things have not come, microincision surgeries all over, laparoscopic surgeries, and joint replacement, which has occurred in orthopedics and radio diagnostics. So some similarly, ophthalmology has also grown phenomenally.
Yeah.
Large
I,
test developed in last 30 years.
yeah, I
So that
feel that I feel that dental and eye health is are two things that people don't take very seriously until or unless there is a problem with it.
I agree.
Yeah.
But now
Okay.
awareness has occurred,
Yeah.
and people are taking it on a positive side, and they want to
Mhm.
do things early and better. Many things have developed.
Yeah. Okay. So after you finished your degree and fellowships, you had a long career as a surgeon. So, could you share a little about those early years and the experiences that shaped your career?
Those were the days when email and all, what is internet, email, and all those things were not developed. These computers and all those, these technologies were not developed. And this I am talking about 1993, 94.
Yeah.
So when I finished my post graduation.
Even Google was
So,
not there.
but there was nothing was there. So speed post was there. So everything used to be through post and speed
Yeah.
post and trunk call, that used to be there. So, but the dream was there that to do something different, and we had chances to enter into government side, government job,
Okay.
and many other options were available in the state in where I am now and in the surrounding states. But I found that we should do something different. What the world is doing in a different way, where the world is going, so that I can be the person or someone who can be the part in the journey of ophthalmology in this region.
Okay.
So that was the idea, and that was the dream, and something in my mind. So after finishing my this thing post graduation, so we searched for taking a dip into getting all other different and better experiences in the good hospitals and good research centers in the country and elsewhere. So we searched around and went throughout the country, all the big institutions in the country, and then we stopped at the Arvind Eye Hospital, which is located at that time, which was at Madurai, and now there are many other branches
Yeah.
in the region. So we went there, and together with my wife, she is a retina person. We started our journey after doing our post graduation, and Dr. Priyamoda and me, we took a fellowship and that we were the first from this Madhya Pradesh state to opt for this kind of fellowship programs and enter into it. So people used to go somewhere and under some doctor or Sitapur Rai Hospital or Aligarh Hospital or something, and to learn the things and techniques and many. That was the shortcut, or rather, that was the trend at that during our days and during that time. But we went there, we took a long fellowship, did it over there, learned many things, and above all, we learned the direction where we should go, and the way that we should think when we are practicing, when we are seeing our patient. So that gave us a big thrust and momentum and a big idea that opened our eyes and our heart and everything, so that we can learn it, and we can bring those things to this region. And they were connected well with the rest of the world.
Hmm.
US, UK, Europe, rest of the Asian countries. So what they were doing at that time, they were pioneer. They were doing serving the masses, and at the same time they were doing a quality work.
Yeah.
So that was required, and that inculcated in our blood and in our hands, in our tips, and everywhere. So that has transformed us tremendously.
Okay.
So that gave us the insight how to practice, how to see the patients with empathy, how to give the best results, where not to do, when to stop, and how to propagate ourselves ethically. All these things we learned from there.
Okay. So it was year 2008 when you founded Ratan Jyoti Netralaya. It has now become one of the leading eye care institutions in the region. So what was your vision at that time, and what were some of the biggest challenges that you faced?
So very interesting question. And in fact, we started after returning from Madurai in 1996 in a small way.
Okay.
So that was a small beginning, and it was a single room practice. And because we had a meager funds during those days, but with our hard work, with our dedication towards the profession, and whatever we learned from Arvind and from our mentors, and we bit by bit and pile by pile, with taking small steps, we developed ourselves. Then came year 2008, when we thought that we should have now an institute where everything is done under one roof. And because that was the mind, something like our mini Arvind, if we can create in this region. That was the thing. Because ophthalmology is the eye is one thing which has got various parts, and each part has now a subspecialty like cornea, orbitochloplasty, the surrounding area, and retina, then glaucoma, and pediatric ophthalmology. So all these are subspecialties, and that has helped. We thought that we should bring all those things in this region. In 2008, fortunately, by the grace of God and the blessings of Dr. APJ Abdul Kalam, he came and inaugurated this institute in
Okay.
2008. Yeah. Though that was the best part, which we have best moment in our life, when he was with us for 2 hours, and he guided us, and we are working on whatever he has guided us, and inculcated within us after Arvind. So with those principles, we started this institute in 2008, and we built again strongly. And because the thing is that it's not the serving to the affluent class of this society.
Yeah.
Our aim was to serve affluent class who can pay, and the class who cannot pay, but they are entitled, they have the birthright to get the good quality of vision, and to get good treatment modalities. So the same equipments we are using for the underprivileged society section of the society, and for the affluent class. So this way we are balancing, and we are surviving, and we are developing, and we are serving everything. So that gives us the maximum utilization of the, or the rather optimum utilization of the equipments and manpower, and at the same time delivering good quality service to the needy persons who are required to be treated, and getting the blessings out of both.
That's
Because
a very
these
noble
bless
thought.
because these blessings you cannot buy, you cannot get it from anyone. You
Yes.
have to earn. If you touch the feet, then only you will get the blessing. If someone's feet, your parents' feet, or your elders' feet, or you touch the feet of our God and everyone, so only then you get the blessings. And the blessings are more than the what we think. Still, we think they are more than what you have earned in terms of money,
Yeah.
because that gives you more satisfaction and more inner this thing contentment.
Yes.
So that is what, and money is required to grow ourselves.
Of course. So, over the years, your hospital has become a trusted name in Madhya Pradesh region. So, when you reflect back on this journey, is there a story of a patient or a case that really showed you the impact of your work, the work you are doing at the hospital?
Many stories are there, many patients are there, innumerable, and I cannot count them. And good part is that they still remember. I still remember a boy, a young boy who was in a police department, had a firecracker blast injury. He was deputed to dispose of the firecrackers which they recovered during Diwali from illicit traders. So he was a young person, so he was asked to dispose them. Unfortunately, the worst part hit him, that came to him, and those crackers blasted in front of him
Okay.
without before he could dispose them. So everything was, because our eyes and our face is the most vulnerable part of the body. So it hit, and both the eyes had many splinters, and a lot of issues were there in both the eyes. And after many surgeries, he remained but dependent on others for at least 1.5 to 2 months. And after that, now he's back to this job with good vision in his both eyes. So many other stories are there. Children who are in the blind school, they have been recovered. Their vision has been restored. And one family came. Both husband and wife are blind. The child is also almost 3.5 years old. So everybody said nothing could be done. They came to us. I operated both of his eyes, and the child is okay. So we said, now Shravan Kumar is with you. Rather, he told me that we are happy that our Shravan Kumar is with us now, and he is able to see. So many stories are there. Many children, many elderly person who have been, yesterday only operated upon a person who came from Tikamgarh. It is a village near. It is a place near Orcha. Orcha is famous for Ram temple, Ram Raja temple. So he came all the way. That I visited so many other places in the country and in MP, and I'm not getting relief. So I'm very unfortunate on this planet. So we operated, and today he is fine. In retina, in glaucoma, many other children are, many patients are there. Cornea transplant. So one other story is there. So one young person, he was returning on the New Year Eve from his work, and because everybody is in a hurry, in the late evening, so he came to my clinic at around 8:30 or so, when everything was, I mean, over. So he was hit on the road, and he fell down and had a road traffic accident with the lot of damage in his eyes. So after so many surgeries, and after, still he is having good vision, very good vision after almost six surgeries. And this is won me the best video award in various national and international forums, how to work and how to save the eye. So that gives us a lot of satisfaction, because eye is one thing where you get rewarded very fast,
Yeah.
unlike other fields, other branches of the medicine. So in the eye, you operate now. Next day, your glasses are, you are able to see without spectacles very clearly. You have operated now. Next day, you are able to see clearly after you have got rid of the cataract. So many a times your vision improves very fast, rapidly, and that's the reason it is very rewarding, Braj.
Okay. So today our lifestyles have changed. There is constant screen use, technology have changed, and people are spending lesser and lesser time doing outdoor activities. So from your perspective as a doctor, so what are the most common eye health issues that you are seeing among patients, and how are these lifestyle changes contributing to these problems?
This is a most relevant question because we see there is a rise in uh, the spectacle wear among the young children and youngsters, and those who are not, those who are having glasses, although their parents and grandparents don't have.
Mm.
So this is mostly because of the lifestyle. And so the causes I would like to enumerate is one, that we should encourage our children to go for outdoor activities like and to play in sun, because sunlight is very important. हमारे क्या नाम है, वेदों में भी कहा गया है कि सूर्य का बहुत बड़ा स्थान है हमारे वेदों में भी, हमारी लाइफ के लिए, हमारी हमारे लिए, हमारे वेल बीइंग के लिए, बिकॉज so lot of vitamin D has got lot of impact on our development and mental health and physical health. So the increase in power and dryness, they are attributed to some extent to the less exposure to sunlight and outdoor activities. So physical activity should be encouraged. Work, field work in sunlight should be encouraged. Less use of screen in any form, maybe tablet, maybe computers, maybe mobile. So we should ask our youngsters work less on this, or give rest to their eyes whenever they are working, so that the impact of these things are less on them. And eat healthy, nutritious food, and homemade food is better in all sense. And eat healthy food. Good diet is very important, and good physical activity. So this will decrease and reduce many ailments which are occurring due to the lifestyle involving the eyes of the young children.
Okay. Apart from, what you mentioned just now, that we should spend time outdoors and eat healthy, are there some simple practical steps that you would recommend to people who can protect their vision and prevent long-term diseases? People who are constantly on the screen. Suppose someone is in an IT job, he cannot avoid his system. So, are there some tips for them?
Means many tips are there. One is that we should keep our screen down, so that if we keep our screen on a higher side, at a higher level, so our eyes will I mean stare, they will keep open for wider area. So the chances of dryness increases. So screen should be down, and proper illumination should be there in the room, so that there is no eye strain. Eat healthy, take plenty of water, take rest in between. What I suggest, 20-20-20 principle. 20-20-20 means after every 20 minutes, give rest to your eyes for 20 seconds and look at a 20-meter distance. Okay. So that way you can reduce the impact of constant working on screen monitor and on the computers. And apart from this, the illumination, as I said, and do proper exercises and convergence exercises, the pen push-up exercises. You can keep your pen or pencil at a distance and bring it close to your eyes, so they will improve your convergence and strengthen the muscles which are required to do the convergence. And if you have to wear spectacles, if you are suggested to wear spectacles, you should always wear them. That is going to relax and reduce the strain on your eyes and progression also to some extent. And for the children, especially, all these things are very important apart from the diet and exposure to the sunlight. And frequent change of glasses is there. Then you should, I'm in cognizance with the specialist, because nowadays opticians, a lot of opticians are there. People go to the optical store and get their spectacles made, and I will suggest that is good. But if you find that your vision is not improving, or you're finding that there is a frequent change is there, or number is increasing largely very fast, so you should get examined by an eye surgeon. Ophthalmologists, they are better equipped, and they are trained in a way that they can guide you in a better way. All these things you can incorporate in your day-to-day life, and help yourself, and be comfortable.
So, ophthalmology has seen so many breakthroughs with new technologies and treatments in the past few decades. And you have introduced several new treatments in your institution at Madhya Pradesh. So, you were the first to start, like I read in on your website, LASIK laser surgery in the region, first to start C3R treatment. So, can you share more about a few of these technologies that you have introduced and what it meant for the patients in the region to have access to the facilities for the very first time?
Uh, Look, I have been traveling different countries to learn about what they are doing, what new is happening in those countries, and what is new in the field of ophthalmology. So that used to be that has always remained a passion for me, and learning subject for me. When I go out, I develop time. I mean, I give my time more towards the studies and all those things which are happening over there, and to learn new things, and from the consultants, and from the way they are, and good equipments to be brought in our country, what new equipments are coming. So with this, I and indigenously also I have developed many techniques to do give the better surgical outcome, better way of doing it. So C3R is a treatment modality, or CXL, what we call now, is a treatment modality for keratoconus. So that entity was, I mean, very laid back entity. We people used to study in books only. We
Okay.
used to see only the advanced cases when we have to do the keratoplasty, means transplanting the cornea from the person who have donated after the death. So those cornea has to be replaced, and that was the only treatment at our during our days, and what we used to learn. So C3R was a new technology, new technique, which came into being, and some 20 years back, and that used to halt the progression of the disease. In early diagnosis, how to do all these things were there, and how to do this thing, and gradually I developed, I learned it, and I brought it to this region, because a lot of children are having this problem, and if we can find it, detect it early, you can save their vision, and they save their eyes. And many are now doing their work, their job, and they are very happy. And I have done thousands of them by now. Other technologies also there, and techniques are there: scleral fixated IUL, then the LASIK laser, because I mean, that is one thing which was very not very popular in this region. People very skeptic, and I learned it. I went abroad. I went to many centers in the country, and found out what is the safest way to do, how we can avoid the complications. So I learned everything, and then brought it over here. So all these things, I tell you, are difficult to start,
Yeah.
because beginning is always difficult for anything, for a new venture or anything. But once it is established, then others can also adopt. So that way, for me, I am having satisfaction that I could start many things in this region. That is good, and I get blessings from the people. But believe me, it's not easy. It
Mhm.
gives you have to spend a lot of efforts and time, and many other things, and then only, and money also, so that it is absorbed, and it is popularized in this region.
Anything new you start, people are going to be skeptical at first, even and considering it is I mean, Even I am afraid of trying something new on my eyes, so I can
Absolutely.
understand that. Okay.
So
So
that was the thing. But
okay.
uh, people were very receptive in this region. That is good. And they trusted us because our results track was good. Track
Yeah.
record was good. So
Okay.
they trusted.
So people have so many misconception about eye health actually, and they are hesitant when it comes to treatment like surgery. So, from your experience, what are the most common myths or fears that patients come with, and how do you help them overcome their doubts?
Many myths are there. One is the seasonal variation, like they want to get their eyes operated in winters only. That is a big myth. And
Yeah.
summers and rains, they want to they avoid. Your parents must also be knowing and saying the same
Yes.
thing. So anything, so they relate to the weather. But I'm happy that we could change to some extent, but still people come with the myth, with this kind of myth. Another thing is that spectacle correction, like refractive surgeries, they are associated with very many myths that how for how long this is going to last, and I mean, what are I mean whether there is any chance of losing the sight, as you were also apprehensive just now you said, and
Yeah.
how will be the recovery of the vision? Is there any other problem associated with this which I have to face? So many things are there associated with it. Myths are there associated. So we have to guide them. We have to be very patient and be towards the side of the patient. So what I do is I think that I'm like a patient. I am attendant of a patient,
Yeah.
and what he is feeling, I am feeling it. So I reply by keeping myself in his place and tell him that all these things, whatever you are asking, are absolutely justifiable. If I would have been in your place, I would have also asked the same thing. But believe me, um, if I can, I am suggesting you. So I am suggesting you because I have my track record. I have seen the results of my previous patients. They have improved. So on those records, on those ground, I'm telling you, recommending you this treatment. So this way, patient feel very comfortable. I tell them that your child is like my child. Your daughter is like my daughter. You will also not like anything going outward or untoward. So even I would not like to have anything untoward to your daughter. So this way, I gain confidence of the patient and their attendant.
You have also taken on the role of training and mentoring young surgeons. So, how do the doctors coming into ophthalmology today differ from those in your time in terms of mindset, skills, and approach to medicine?
Interesting. Um, there are two things. One is the mindset which you said. So mindset of newer generation doctors is very fast, very good, and they are very receptive and adaptive. And the thing is that they're very fast because this generation Z is very fast and active. So
Yeah.
so that is the good part of this situation, and they are very open, very receptive. Only thing is that the sincerity towards subject and towards the patient, that we have to give to them, because during their education period, I think that focus on this part is less. So that's why we impart this thing also, that you should be more empathetic towards your patient and sincere towards your patients. That will give you an idea. I think this was there in during our days also, because nothing of this kind is taught in our curriculum when we are doing post graduation or something, or undergraduation. So the generation, these students are good, very good, I should say, and learning is good, very fast, and happy to see them. Only difference is the girls are more in this profession now.
Yes.
I mean, say 70%, 60 to 70% are girls in last 10 years. Trend has changed phenomenally. 60% of them are girls. So that is something. And sincerity amongst the girls is very, I mean, high. So they take things very seriously, and so that is good thing. So training is good, and due to training the students, we also develop ourselves. We also have to keep ourselves abreast with the subject, newer things, and keep ourselves updated. So that is very much required, because this is an institution, as I said earlier, and we have all the subspecialty branches. Like this is the only center in this region which has got all these branches, subspecialty departments in this hospital.
Yeah.
Refractive, for the spectacle correction, we do everything from keratoconus modalities to myopia, hypermetropia, astigmatic correction, near vision correction, and ICL, LASIK, everything we do. And to correct the to impart good vision to our patients. And cornea, we do keratoplasties, lamellar keratoplasties, patients with burn, patients with trauma. We manage, we get a lot of trauma patients in our region. Then chemical burn, chemical injury, though these are very, very dangerous and very, they require a lot of patience. And
Yeah.
even after doing many things, you cannot get good vision, but we do it. So that whosoever can achieve, can have good vision, at least they should get. Then the glaucoma, which is another blinding disease. So if it is timely managed, then all we are having four consultants in retina department. So that is a big department where we to treat diabetic retinopathy, hypertensive retinopathy, vitreous hemorrhage, age-related diseases, retinal detachment, congenital deformities, retinopathy of prematurity, and ROP when the child is newborn. So at 1, 2, 3 months of age, they develop the new vessels in the eye and bleeding in the eye. So all those things we manage and we treat here every day. And pediatric ophthalmology, squint correction, orbitocleplasty like in thyroid disease, in orbital tumors of the eye. So all these problems are there which happen to the patient, and those tumors have to be removed. And thyroid ophthalmopathy, when eyeball is bulging out, protruding out, trauma, fractures of the surrounding area, cut, and all those things are happening. So we put implants in the eye, support the eye, bring it back to the normal position, and keep it in the center. So that way, restore the anatomy and placement of the eye, so that the cosmesis as well as visual function, they are preserved. Otherwise, one eye is in this side, other eye is straight. So all those problems, one eye is displaced down. Then squint correction means when there is a disbalance between the eyes. So both the eyes are looking inside, or one eye is outside, one eye is this side. So one eye is upturned. Pediatric ophthalmology, we do operate a child of 2 months to up to, and we operate up to, and elderly person of geriatric person of 90 years of age. I myself have operated upon the freedom fighters at 98 years of age, and 104 years of lady. She was brought to me on tractor trolley, and we operated. He came with, I think, 50 persons. All of them were because she was not able to see from both her eyes. So
Mm-hmm.
they brought her. आप सर इनको कैसे भी कुछ कर सकते हैं तो कर दीजिएगा. Let her see before she departs. Um, so for the natural journey. So we operated. That was my 104 years of age lady. I operated upon. That is the maximum age I have operated, and 2 months of the childhood we have operated so many patients. So this way, it gives me a lot of satisfaction and contention that we are able to serve this region with the for their ailments, with the problems which they have. They don't have to go at different places, and spend more, and because many of them, they don't go, they take it like that only,
Yeah.
because they poor from their background. So hardly 10% of them they can go out. Or if there is a pain, then only they go. Otherwise, they
Yeah.
remain silent and stay back in their village only.
I hail from Bihar, and when I was a young child, if someone has a eye problem and they need to have surgeries, people used to travel to Nepal
Oh,
to get the
take up.
surgeries done because yeah,
So that was the border area
yeah,
of Nepal, yeah, from Bihar.
mm,
Still, I think a lot of patients are going in because we were not having good facilities in this region.
yeah, and the
And
cost.
yeah,
And the
absolutely.
cost is there the factor because their treatments were cheaper compared to what we had in our country. That's very nice of you for starting such an institution, that too in Gwalior. So yeah. Also, I remember when I first started having blurred vision, I could not look clearly. I told my parents that I could not see the blackboard while sitting in the back. They did not believe me. They said, "You're lying because you don't want to study." It took
Absolutely.
me to about a month to convince them to go see a doctor. And then when the doctor told them that, yes, her vision is, yeah, then only they believed that I'm,
It's still, I mean, that is still prevalent, and people don't really. For that, I think what I feel is that well, the important thing is that we should have a school eye checkups done for all
yeah,
the students. So that should be the mandatory part of the curriculum. And once in a year, eye health and regular body checkup of all the students should be done, so that we
yes,
can pick the things early. You are lucky that with these spectacles you are able to see, but many a times you cannot be such a, God cannot be so forgiving. Many a
yeah.
times, if it is missed, it is missed forever. The vision is lost forever.
Okay. So enough of the serious talks. Let's move to the innovation part. We are seeing AI everywhere today in our phones, work, and even healthcare. So in ophthalmology, how are doctors using AI, and what role does it play in your day-to-day work?
Many things are being developed, and use of AI is increasing in our branch also, and more so in diagnosing the diseases. It helps us in diagnosing the disease, because if you have to see the pictures, you require multiple things, and multiple times you have to look into it. But when the AI is into the machine, it gives us the finding, the result, that the probability of this is more. But I will say that AI is very helpful, but it cannot match as of now to the human brain.
Yeah.
So it is very helpful to us nowadays, and in diabetic retinopathy screening also we are using it. Today I am going to be in a teleophthalmology session in a webinar where how to manage the patients who are sitting remotely in the village with the teleophthalmology. So and many things in this we can use AI also to develop it. Many the new machines which are coming up, they are using AI facility, and that way they will tell us the probability of error when we do something, and tell us about the uh, uh, the diagnosis which is close to or near to what they are feeling. You have to I mean, correlate it with other things,
Mm.
systemic things and other surrounding things, and then you can come to the final diagnosis. So that way it is helping us a lot.
Okay. So looking ahead, like you mentioned, ophthalmology. So beyond AI and beyond, telemedicine, teleophthalmology, what other new surgical techniques, or how are you seeing the field of ophthalmology evolve in the next decade? What excites you most about the future of eye care?
Future of eye care will be we can operate from remote areas, so that we can that may develop in near future, because if some tools are there, similar machines are there at a different center in the world anywhere,
The
and
robotic
you have
machines.
robotic kind of thing that can be developed in the ophthalmology also, because that is not a I think it is not going to be far that this is going to happen. And diagnosis will be very, very easy for for the patient and for the doctors. So role of opticians and optometrists will increase, and they will what we will take call them as a paramedical ophthalmic assistants. So they will be working like an ophthalmic assistants, ophthalmologist like things. So many things like spectacle dispensing and change of spectacles. If any error is there, probability will show to the optometrist, and he will refer the patient to the nearby doctor, or the patient, the choice of the patient, wherever they want, they can go. So this immediately in the prescription they will get that you need to see this cornea specialist, you need to see the retina specialist. So and in the same sitting they will take everything, picture of the cornea, picture of the retina, picture of the optic nerve, angle of the optic nerve, everything will be done in the one picture only, one sitting. Immediately final report will come.
Okay.
So with this that will make the things more interesting, more comprehensive and fast. So that will, because our population is more, so for the country, and we are, our population is in a remote areas where access to the doctors is less. So all these things will be very, very helpful. And with the satellites and internet, everything is possible. You can do everything on your mobile also. So
Okay.
two things I am looking. One, remote surgeries by the specialist. So patient is we have to develop a center in the village, in the primary health center, where things are available, equipments are available, tools, machines, and microscope, everything is available. Only problem is that manpower is not there. Efficient manpower cannot go there.
Hmm.
That is the only issue as of now. You can spend, you can develop the infrastructure, you can develop a building, you can place the equipments. That is not a big thing. Only thing required is a good human being, good doctor who has to operate, who has to diagnose the patient. So that will be replaced by these doctors, with these robots and AI and other. So that will be the advancement of AI.
Of course. That is what AI is all about, not to replace human beings, but to make things easier, faster, and more convenient for. Okay. So I am down to my last question. What advice would you offer to someone who is looking to have a career as an ophthalmologist or, any medical field to say?
I would say this is the best branch in the medicine, and you get the results very fast. So patient satisfaction is good, and only thing is you have to give more time to towards your patients.
Yeah.
But this is the best branch amongst all, and the patients are very, very happy with after they visit you, and when they regain their vision, they feel very contented, very happy, and give a lot of blessings. And only thing is that you have to give more time, you have to study hard, you have to have the hand-eye coordination, and your neuro adaptation should be good to give the best things to the patients. That is what, and that comes with learning. If
Yes.
you are good in learning, you can become master and become a good human being and a good doctor. That's what it is. So I welcome all those who are interested in ophthalmology to come and join this. This is one of the best branch, I should say.
Okay. Okay. Dr. Bhasin, thank you so much for sharing your story and your thoughts with us today. And it has been a wonderful time. I spent listening to your journey and your vision behind Ratan Jyoti Netralaya.
Thank you. God bless you.
Thank you
And
so much, sir.
everybody flourishes with you
Thank you.
together by the grace of God. Thank
Thank
you.
you, sir.